Good afternoon. Myself, Dr. Sheetal, Medical Officer, Felix Hospital. Welcome in our Doctor Live. आज हमारे साथ हैं डॉक्टर सोनिया, गायनोकोलॉजिस्ट, फेलिक्स हॉस्पिटल. वेलकम मैम, वेलकम इन आवर डॉक्टर लाइव. सो आज हम डॉक्टर साहब से बात करेंगे ओवेरियन सिस्ट पे. मैम, जानना चाहेंगे आपसे ओवेरियन सिस्ट क्या है?
अंडादानी के अंदर या अंडादानी की सरफेस में फ्लूइड फिल्ड पॉकेट्स और masses. These are called as ovarian cysts.
Ovarian cyst.
There are many types of ovarian cysts. Mainly there are three types of ovarian cysts. One is functional, one is pathological cyst which can be associated with some disease process, and rarely we have the cancerous cyst.
Okay. मैम, ये ओवेरियन सिस्ट के साथ पेशेंट्स कुछ कंप्लेंट्स के साथ आते होंगे आपके पास?
Many a times these cysts can be asymptomatic. It is discovered incidentally on an ultrasound.
Okay.
Sometimes the patient can present with symptoms like sometimes it will be vague symptoms like bloating, dyspepsia. Some patients can have pelvic pain. Sometimes it can be severe pain like in complicated cases like torsion ovarian cyst.
Okay.
Some can have menstrual abnormalities like irregular periods or heavy periods or scanty periods. Some can have pain during intercourse. Or sometimes they can have pressure symptoms like difficulty in passing, like difficulty in emptying the bowel or passing urine. Or sometimes some patients can have mass abdomen. They can feel abdominal fullness. So these are the different symptoms.
Okay. Ma'am, अगर हम causes की बात करें तो किस वजह से ये ovarian cyst बनती है?
Yeah, the causes depends on the type of cyst. So there are different types of cyst. For functional cyst, it usually occurs due to the fault in the ovulation. So for that we should know about the physiology. So every month one egg is released from the ovary and this process is called ovulation. So the egg develops inside a structure called the ovarian follicle. जब वो follicle पूरा mature होता है, वो rupture होता है and the egg is released. That is called ovulation.
Okay.
And once ovulation takes place, the follicle becomes a structure called the corpus luteum. So if ovulation does not take place, the follicle enlarges and gets filled with fluid, then it is a follicular cyst. And if the corpus luteum enlarges and it gets filled with fluid or blood, then it becomes a corpus luteal cyst. So these are basically due to ovulation disturbances. Then there is a condition called polycystic ovarian disease. इसमें there will be tiny multiple cysts on the ovarian surface. This is also due to a ovulatory dysfunction which is caused by a hormonal imbalance. Then there are other cysts like endometriotic cysts. This is associated with a disease process called endometriosis. Here what happens is the endometrial lining it develops outside the uterine cavity. So the menstrual blood can flow in a retrograde direction and can become ovarian cyst.
Okay.
Then another type of cyst is dermoid cyst. Then we have cyst adenomas. Cyst adenomas can be benign or sometimes they can become cancerous cyst.
Okay. Ma'am, if we talk about diagnosis, so diagnosis कैसे रहेगा? Is it a clinical diagnosis or कोई particular radiological diagnosis रहता है?
I already told you sometimes the routine ultrasound can show an ovarian cyst. Means the patient may be asymptomatic. If the patient presents with symptom, cyst can be detected either on an abdominal examination or an internal pelvic examination. But it should be confirmed with an ultrasound.
Okay.
So from the ultrasound we can know the location of cyst, what is the size of the cyst, what is the nature of the cyst, any suspicion of cancer, all these things. Now, if the ultrasound is not very conclusive, then we need additional imaging techniques like CT or MRI. And sometimes we need to do some blood test also like CA-125, which is a tumor marker.
Okay. तो मैम क्या ये ज़रूरी है कि सारी सिस्ट कैंसरस हो सकती हैं?
नहीं, ज़रूरी नहीं है. Most of the cysts are benign. Some of the cysts are functional, which are absolutely harmless cysts. So very few cysts are cancerous.
Okay. तो मैम अगर हम ट्रीटमेंट की बात करें तो क्या सभी ओवेरियन सिस्ट का सर्जिकल ट्रीटमेंट ही रहता है?
No, there are different modalities of treatment. So the treatment depends upon several factors like age of the patient, what is the menopausal status, is the patient postmenopausal, what is the size of the cyst, what are the symptoms of the cyst, what is the nature of the cyst on ultrasound. So ये सब factors की dependent होता है treatment. Now treatment basically 3 options होता है. One is expectant treatment where we just monitor the patient. Second is medical management where you can give oral contraceptive pills. And third is surgery. Now which patients we go for a expectant management? That is mainly for the follicular cyst. Because these cysts are harmless. You just need to monitor them for a while. Usually they disappear by itself. So you may repeat ultrasound after a few months and the cyst disappears. Second is where you give OCs, that is for recurrent cyst. So what oral contraceptive do is it stops ovulation. So it prevents the development of new cyst. So that's how it works. And oral contraceptive have an advantage that it reduces the risk of ovarian cancer. So studies say that 5 years usage of OC pills reduces the risk of ovarian cancer by 50%. So that advantage is also there. Now, in which patients do we do surgery for the cyst? It is when the cyst is of a large size, say more than 6 centimeter, or the cyst is symptomatic like persistent pain, persistent menstrual abnormalities, or if there is a suspicion of cancer. Because surgery, we remove the cyst and we have a diagnosis, histopathological diagnosis, so we can confirm that there is cancer or no cancer. And in surgery, most of the cysts can be treated through laparoscopic technique. So this is a minimal invasive surgery where we put very small incisions on the abdomen around 2 centimeter, and most of the cysts can be removed laparoscopically.
Okay. Ma'am, can this ovarian cyst reoccur?
Yes, there are some cysts which recur, and this usually is seen in the reproductive age group and in patients with polycystic ovarian syndrome.
Okay.
Yeah.
Thank you so much, ma'am. Thanks a lot. So, ovarian cyst के रिगार्डिंग अगर आपके कोई भी क्वेश्चंस हैं तो प्लीज़ हमारे कमेंट बॉक्स में अपना क्वेश्चन ज़रूर लिखें, अपना फ़ोन नंबर लिखें, या आप कुछ और मैम से पूछना चाहते हैं तो हम खुद आपके क्वेश्चंस का आपको कॉल करके जवाब देंगे. थैंक यू सो मच.